Welcome to Call Doctor podcast. Today we have the pleasure of hosting Dr. Rahul Bhatt, a specialist urologist with over 20 years of experience who have been practicing advanced urology in Dubai for the past decade. Dr. Rahul, can you give us an overview about bladder cancer and prostate cancer? Who are at risk? What is the most common causes?
So bladder cancer and prostate cancer, there are two different kind of categories. The bladder cancer I'll come to first. Now, these people are having bladder cancers more common in whom they have heavy smoking history or in certain professions like tire manufacturing industry, because the kind of chemicals that are released when the tires are manufactured, or in textile industry where you have certain aniline dyes which are released into the environment, and in their working environment that creates bladder cancers. And if there's more arsenic in the water, drinking water, these are the major factors which create cancer. Otherwise, cancer can come in anybody, but these are the factors which create cancers. Prostate cancer as such, there is nothing much, but it's more of a diet which is more Western. Oriental diet is most comfortable, which is protective against prostate cancer. The Asian diet is also good, but the Western diet is more favoring cancer development of the prostate, apart from hereditary factors.
Doctor, what is the early signs of cancer? Either it is prostate cancer or bladder cancer. What is one sign that people should never ignore?
So for the bladder cancer, the signs are different than the prostate cancer. And for bladder cancer, the most common sign is blood in the urine. Although blood can come from many reasons, and it's definitely a reason to panic. But all the blood, what comes in the urine is not because of cancer. There are other sources like stones and infection which can create blood in the urine. But if you have blood in the urine, that is the earliest sign of bladder cancer. Along with that, you may also have frequent urination or difficulty controlling the urination. These are the early signs. For the prostate cancer, the early sign, there's nothing very specific, but a person would have frequent voiding, burning in the urine, and these two things may be there without any other things positive in the ultrasound or in the routine blood test, unless some certain blood tests are done to differentiate.
So, Doctor, as our conversation, I understood one thing that, prostate cancer, there is no specific signs. We think that it's elderly and the signs are very normal to have. What is your recommendation that somebody should follow as a routine for them to detect prostate cancer?
So as a routine, even as per the guidelines of American and European boards, at the age of 45 is the time when we can start prostate cancer screening, but we must start at the age of 15. Now the testing that is required for prostate cancer, the basic thing is called PSA. It's a blood test which should be done in all males irrespective of symptoms at the age of 50. But 45 in those families who have their first blood relative as positive for prostate cancer. So if somebody's father or brother, first blood relative is having prostate cancer, they can start at 45. And if the value is normal, which is ideally it should be less than 4, but if it is less than 1, then we can do that check of PSA once in 3 years. We don't need to repeat it every year. But if it is between 3 and 4, it's in the borderline range, then we should repeat it at least once in a year to see the trend.
Doctor, how does early detection impact the treatment and survival rate?
So early detection is the golden period, I would say, and everybody should move towards the goal of early detection by whatever means. As I said, for prostate cancer, the blood test; for the bladder cancer, the different set of tests. But the early detection would give you the golden period of cure from the disease and a normal life. That is the best part. You can live a normal, healthy life. But if it is late, it is a control in which you have to live with the disease. The disease can come back, and then there are hardly any modalities left at the end to make your survival easy. So as for the success rate and the survival rate is concerned, if it is a bladder cancer and it's an early detection, which means the cancer is of low grade and confined to the bladder superficially, then the cure rate is nearly 95 to 100%, which means if he has to live till 80 years because of the various disease, 95 to 100% of the patients would live up to that year. For the prostate cancer, the survival rate, if it is a low grade again with organ confined, which means confined to the prostate, then again the success rate goes from 98 to 100% based on the same criteria. Now, the things would change a bit if the grade changes in the biopsy, which makes it high grade, organ confined within the bladder. Then the survival rate would drop to 88 to 90%. In the prostate cancer, again, if it's a high grade organ confined, the success rate would go 85 to 90%.
So the key is early
detection, yes.
Coming to bladder cancer, what are the best screening tests to be done and what age should people start doing it?
So the age group for bladder cancer in say about 20 years back, the bladder cancer was common after the age of 40, 45. But the age has shifted a bit early nowadays. Now people as young as 28 I've seen having bladder cancers, and it is not uncommon in 30s to have bladder cancer. So, but then still we should focus more on the 40 plus age group, and they should at least get ultrasound done for the bladder once in a year, even if they don't have any symptoms. And if there is something suspicious in the bladder in the ultrasound, they should get a urine cytology test, which is having a look of these cells coming in the urine under the microscope in the lab. And if it says these cells are not normal, it indicates towards cancer. Now these same tests have to be done in case blood comes in the urine, but even if they are not symptomatic, at the age of 40, one should start getting an ultrasound done to see the changes in the bladder, and if required, a cytology test.
What is the screening test which has to be done for a prostate cancer detection, early detection? And what is the best age to be done?
The best age, 50 plus, definitely one has to start on with the prostate screening, which is the blood test called PSA. The family, if it's a first blood relative, then at the age of 45, but if there are 2 or more relatives having in the same family, whether it is a first or second degree, then they should even start at the age of 40. Now, the prostate cancer as a routine is less prevalent in the Japanese and the Oriental population. In the Asian population, it is slightly more than the Oriental, but in the black population of US and the black population other places as well, because of the Western diet, the incidence of prostate cancer is much higher than the non-black population of these places. So they should start at the age of 40.
Many of the elderly patients are very hesitant to go to hospital. How can a home-based service help in early detection?
So for the prostate cancer, I'll come first. It's easy because this test called PSA is a blood test. And during any home visits, during the home test, they can add on the PSA test. And if it's normal, at least they have the confidence that it would not be there. So that's a big relief. For the bladder cancer, the only thing is the urine cytology test, which I was talking about. The urine sample, but then it has to reach the lab in a short period of time. And if that is feasible, then they can detect the cells in the urine which is cancerous or not. Also, the legislations keep changing, but if the ultrasound at home is possible, because nowadays we have an ultrasound machine which is attached to the iPhone, and you can do it as a screening at the home place, and it's not difficult to detect some abnormalities, so that can be a plus factor.
Doctor, is there any specific lifestyle modification that we can implement in our life which can reduce the risk of getting cancers like this prostate or bladder cancer?
So yeah, for the bladder cancer, I'll come first. Smoking, it's a heavily prevalent thing, and smoking has got a very, very strong correlation with bladder cancers. After the lung cancer, it is the bladder cancer which comes next in smoking. Apart from that, your water intake, if it's containing more arsenic, which can be tested, one should avoid that because that is directly related with the bladder cancer development. The other smaller things is, which I don't think is so common, is paracetamol, the simple tablet for fever. If people take too many for too long, that is also an added factor for bladder cancer. Along with professions in the textile industry or the tire industry, they should get their health checks more regular, more frequent than the general population because they are more prone to it. For the prostate cancer, I believe the diet is a big factor. So if you can avoid taking more of carbs, taking more of herbs, and taking more of, say, green tea and other things which are more antioxidant, they would help in prostate cancer.
So being a bit more specific, like people now, they are so used to vaping. And
Right.
people are so used to shisha, thinking that, okay, we are just doing it once in a while. Or vaping, it's because it's been very easy for them to keep vaping throughout the day because it doesn't give any sort of bad smell or anything. So what do you comment on this?
So as far as the vaping is concerned, I'll come to that first. Now, vaping has got the similar chemicals which will have impact on the bladder. Now, the two people one is who's vaping quite a lot, one who's vaping say once in a week or something. Now, it all depends upon the genetic susceptibility. Nobody knows what is your genetic susceptibility. So, of course, heavy vaping will have the effects on the lungs, which is quite clear and evident, but it will also have effect on the bladder. Time will tell about that, how much is the incidence, but it definitely has
An impact.
Correct. And the genetic susceptibility is something which is hidden. And even if you do it occasionally, you're still prone to it, and you're adding the strain of the vape on the cancer development.
Okay, how does hydration play an important role in urology health?
Hydration, one should understand that the body is 70% water. And without water, the body dysfunctions. So one should always aim for good hydration, because any chemical, any metabolite, which of course is toxic, is excreted to the kidney. And if you're not taking enough water to hydrate, to flush out, these chemicals are going to act at some point against your body, because they are ultimately supposed to go out of the body. The more you delay by decreasing your hydration, they're going to stay and get in contact with the layers of the epithelium. So which chemical is acting and how, that is a basic thing. Apart from that, of course, if you're not hydrated enough, you get disease like stones and infection, which are the common things. And it does affect the electrolyte balance in the body by decreasing the water intake.
There is a lot of confusion, like one should drink 2 liters of water, 3 liters of water according to the weight. How can you help us understanding this?
I would first come to people between the age of 14 to end of the life. In general, for these people, the amount of water that is to be used, if one can have 2 liters of urine, that's a healthy kidney function. Now, nobody can measure every day how much is the water intake which is causing 2 liters. A rough estimate would be a urine which is as good as water or minimally yellow. But the best way how to have a good hydration is taking about half a glass water every hour from morning 6 to evening 6. And from evening 6 to morning 6 only in sips, whatever is required, because the body doesn't require water late in the evening hours, because in sleep, it's most of the blood is going to the kidneys. Okay. The rest of the body is sleeping. So what it translates to is somewhere around 2.5 liters to 3 liters of fluids in the winter months, and 3 to 4 liters in summer months, based on your outdoors, indoors. But of course, if you are exercising or in the heat, then you have to compensate by more so that you can adjust with the urine color.
How can people take proactive steps today to protect their health?
If it's regarding non-cancer health or cancer health, but in general, diet is the first thing to be considered, because there's nothing which comes before diet which is more important. There's certain disease, stress does have an impact. There are different diseases which have more impact with stress, some with less, some with no. But then stress is for overall well-being. So the first would be diet, second would be stress, third will be your lifestyle, which includes smoking, sugars. Sugar is one of the biggest poisons these days. So one should stay away from whatever form of sugar. Sugar, whether it's synthetic or natural or alternative form of sugars, they are all not only for diabetes, but for different cancers or diseases. It's a starting point. And your bodily activity, which maintains your muscles and bones, because that is what is required in the older age. You need a fit body to carry on yourself, not depending upon others, which would create a better confidence in you yourself that you're staying away from disease, negative thoughts.
What makes you happy being a doctor?
For me, the best thing is I can relate to my patients in a transparent way. I don't want technical jargon with them, and so that they can understand and they feel more confident when they meet me that they have got a right output, and tell them the different options, and also tell them that what if you do this and what if you don't do this, both ways, plus and minus, so that they have a fully informed decision to make their own choice. And most of the patients are good enough, intelligent enough, they understand the concept of the overall transparency, and they move ahead in life in a healthy manner. That gives me satisfaction that I've taught one person to be healthy.
Amazing, doctor. Thanks a lot for coming here for our podcast and giving us such a wonderful knowledge sharing in detail, in depth. Thanks so much.
Thank you, Dr. Rageena, for the interactive, interesting session. I really enjoyed it.
Thank you.